Everyone brings their own experience to the table, their own knowledge base, and that's very important in patient care.
Salina Khushal's talking about the interprofessional simulation training that centers around collaboration among students from Jefferson College of Health Sciences and Virginia Tech Carilion School of Medicine.
It is a true simulation. We have trained, standardized patients who are painted up to look like trauma cases. We have rather detailed scenarios that the standardized patients follow and that the students in their team will then be able to assess and come up with a working diagnosis, a plan for treatment, and caring for the patients along the way.
Many medical schools, and currently probably most medical schools, do have that now, but we also go into health sciences education, and that's where it's very, very different.
Like they're getting ready on the set of a movie, those trained, standardized patients are ready to show students what it's like to respond to an explosion. The simulation challenges students through different stages of the care process.
One, it does prepare them to deal with mass casualties and emergency situations, but more importantly, we're trying to get our students into interprofessional teamwork thinking.
Organizers have been planning this interprofessional simulation for the last 7 months. About 300 students take part. It's very important for those students to learn how to collaborate now so they can provide the best possible patient care in the future.
Medical students are working with nursing students, working with PA students, working with occupational therapy, EMS students, in the way that we think medicine is going to continually be practiced now and in the future.
That's what happens in real life. You know, you don't really have time to sit down and talk about what you're going to do beforehand, but just knowing and respecting each other and learning how to work together is really important.
It's great to work with the nursing students, PA students, respiratory therapy, and kind of see what they've learned and how they can add to not only this experience but to patient care when, you know, looking years from now.
It only made sense to act on that and work together in doing these two important programs, bringing them together and building on the synergy that already existed.
Virginia Tech Carilion School of Medicine and Jefferson College of Health Sciences working together to make sure students are prepared for providing the best care possible long after graduation. Karen McNew for Carilion Clinic.